Patient registry is a unique resource for CF. The patient registry was started in the 1960s and is a longitudinal collection of data from almost all patients cared for in CF care centers around the United States.
And it contains clinical data and demographic data and allows us to look at various risk factors and associations to help understand the course of the disease.
The registry has a positive impact on decision-making in clinical care because it has allowed us to embark on important research projects, quality improvement projects, and is also directly used in clinical care. In terms of clinical care, it's used to track individual outcomes over time in terms of such things as lung function, body mass index, and weight.
We've been particularly interested in the different kinds of bacteria that are isolated from the lungs of individuals with cystic fibrosis. And we've conducted 2 different studies using the registry. And we were able to find, thanks to the data in the registry, that the number of people with cystic fibrosis who have Pseudomonas aeruginosa, who have some of the Burkholderia species, for example, are actually declining among different age groups, which is really exciting.
The registry data can be used to improve care in a couple of different ways. First of all, we have these wonderful reports that we can generate for each individual patient that allows the care team to get together and really look at what's going on with the individual patient, assemble their data, and have a better understanding of what the individual patient's needs are at each visit. In addition, we can combine the data at a population level that can be used at each individual care center for the team to have a better idea of overall what they're doing, what they need to improve on, and what the overall trends are for their patient populations.
The registry data really complements our clinical trial research. In clinical trials, we test new therapies in a very controlled setting for safety and efficacy, and usually among about 200 to 300 patients. The registry allows us to understand how those therapies are then adopted into standard of care and their associated outcomes across thousands of patients. So it provides us a very powerful resource to better understand the impact of new therapies. Some of the challenges might be that it's more subject to missing data than clinical trials, but really the strength is in the numbers when it comes to the registry, and the fact that we have data on so many patients helps to mitigate some of these traditional problems inherent to observational research.
The patient registry has been fairly essential to research. First, it's the only way we document the natural history of CF and how it's changing over time. The next thing it's been useful is for us to understand different factors that may impact the future of CF patients, and these are called association studies.
The patients who consent for the registry are research partners. Their contribution to the registry have made so many positive research findings that we could not do without their data in the registry.
The people who are entering the data to the Cystic Fibrosis Foundation registry are absolutely essential to the enterprise. And it's really important that they recognize, that we recognize, that they're doing a great job.